mental health issues are peaking at its highest in Malaysia. Recent studies show that the highest prevalence rates of mental illness are shown in youth and young adults, more than tripling the numbers in the last decade.
COVID-19 is taking a mounting toll on mental health in Malaysia.
We saw over 400 people ended their lives tragically in the first 5 months of this year.
Police revealed that 51% of suicide cases in the last 2 years were young people aged 15. Does that scare you? I don't want to be alone.
Good evening, Surumban. It's 3 p.m. on October 31st. I'm FATIN IRDINA reporting from news to you. There has been a worldwide uptick in reported cases of mental illness in the recent years. In Malaysia, mental illness accounted for 8.6% of the total deaths, as shown in the Disease Burden Study 2004, and ranked 4th as the leading cause of the burdens of disease. In Malaysia, there is varieties of policies, regulations, structures to guide the development of mental health services. The National Mental Health Policies of Malaysia was developed in 1998 to build a society that is mentally healthy and balanced, with an emphasis on promoting mental health and avoiding psychological illnesses such as bipolar disorder and depression. Moreover, the policy aims to provide rehabilitation and treatment to those with chronic impairments, as well as suitable and sufficient facility for patient care. Today, I will be interviewing the Ministers of Health, 2 students, 2 public workers, and any individual going through anxiety and depression. According to YB AMILA and her deputy, YB WIDA, there are numerous strategies which have been implemented in this policy.
First of all, there are a lot of strategies that have been implemented by our ministry under this policy, but we only highlighting 3 strategies, which is promotion of mental health, child and adolescent psychiatry, and clinical psychology services. All these strategies actually have connection to all 4 main objectives under psychiatry and mental health services operational policy. So the first strategy is promoting mental health, and it was in line with the objective number 3 and number 4. To begin with, promotion of mental health offers various advantages such as can reduce the risk of mental health issue among all group of people. Because when everybody has a good mental health, it can help to build a good society and can create a good environment to our country that in line with Malaysia plan. So there are 3 activities that has been made under promotion of mental health. The first is the World of Mental Health Day. It was celebrated every year on 10 October, and the theme of the World Mental Health Day for this year is making mental health and well-being for all a global priority. The second is mental health promotion activities in schools, such as introducing Young Doctor Club and also Pro Start in school level. The last is mental health promotion using web portal or media such as creating InfoShare portal and also myhealth.government.com portal. This portal helps to making people's life easier to get information pertaining mental health, and also any other information also available in this portal. So the next 2 strategies will be explained by YB WIDA because I gotta go for a meeting. Bye, thank you.
For the first point is child and adolescent. Child and adolescent psychiatry is a vital and unique subspecialty that is generally a prerequisite for serving children and adolescents who are under age 18. Child and adolescent psychiatrists have a critical opportunity to intervene with young and their family system to prevent psychiatric disorders, of which almost half begin prior to the age of 18 years. Especially in the face of a global pandemic that disrupts young health and development in so many ways. There is a critical need to ensure that the future workforce of psychiatrists, physicians, and allied health professionals is adequately built and sufficiently prepared to serve the mental health needs of children, adolescents, and families in home, schools, juvenile detention centers, and communities. The National Mental Health Service policies framework has been the blueprint for mental health. The visions out in the framework emphasize the promotion of mental health and prevention of psychological problems. Aligned with the MOH goal, NMHSP primarily aims to provide service to those with the greatest overall needs through comprehensive care, treatment, control, protection, and rehabilitation. In Malaysia, mental health service for children and adolescents were initially started by general psychiatrists. The Mental Health Atlas 2011 by the World Health Organization has revealed a considerable difference in median numbers of health professionals in the mental health sector in Malaysia compared with other upper middle income countries. There are 0.83 psychiatrists per 100,000 population, significantly fewer than in other upper middle income countries. In Malaysia, mental health service for children were mainly provided in over 30 general hospital psychiatric units situated throughout the country. The service were mainly provided by general psychiatrists and less than 10 child psychiatrists. Since early 2000, the service have been integrated into primary care through the establishment of primary care of mental health service.
I can see that COVID had directly affected all the citizens from all different age groups in this country. Therefore, with that being said, there is no denying that with the increased number of mental health patients, this also leads to the increased number of suicide deaths. All in all, I can say that this public policy was not ready for COVID. Other than that is how the importance of mental health was only realized during this ongoing pandemic. Unfortunately, this public policy is usually ignored in most countries. So when the government actually sees what this COVID does to the citizens, only then they put more effort into it.
Assalamualaikum. I am a Dr. AZRI. I am a psychiatrist at Selayang Hospital. Nowadays, we can see that mental health problems are very common in our society and a lot of suicide cases keep increasing day by day. That's why the existence of the National Mental Health Policy is very significant in combating this issue. However, I believe this policy is not as effective as we thought, since it has failed to meet several objectives that should be achieved in the first place. According to the first objective of this policy, that is comprehensive, effective and efficient services, we found that the government has failed to meet this objective successfully. Mental health services in this country are in a dire need of improvement and development from various angles, covering of aspect of treatment and rehabilitation, research and development, and training of mental health clinical perspective. Using the right treatment and showing compassion is very vital. Otherwise, this might make the patient dissatisfied and feel worse than before. We also need to know more and more patients also come from adolescents. When they have mental disorder, we need to use a different approach towards them, and thus it needs medical or mental health care professional to be equipped with the adequate experience, knowledge, skills and ability. It only can be done by providing training to them to make improvement in services in the future. As for the next objective, which are integrated psychiatric services in mainstream general healthcare and continuous services, I found that the number of psychiatrists in this country is way short of the target. According to the 2008 nationwide survey in the mental healthcare services in Malaysia, there were only 410 of registered psychiatrists in Malaysia, with a psychiatrist to a population ratio of 1.27 to 100,000, far from the WHO recommended ratio of 1 to 10,000. There is still a huge disparity in the distribution of the psychiatrists in Malaysia, especially in the more rural area. For instance, Kuala Lumpur has the best ratio of 5.24 per 100,000 population. Unfortunately, Sabah and Kedah have the worst ratio of 0.54 and 0.55 per 100,000 population respectively. Therefore, the report clearly has revealed that the mental health human resource level in Malaysia are relatively low. This poses a big challenge in developing mental health services throughout the country and eventually makes the national mental health policy looks weak and incompatible since it did not fully achieve the desired objective of this policy.
Assalamualaikum and good day. I'm Dr. HANNAN YUSOF. I work as Secretary at International Islamic University Malaysia. I stand here today to discuss and analyze the mental health policy that was implemented in our country, whether it is useful or not. We cannot deny that every human life is full of pressure. Stress can be seen from a negative and positive side. So, the government had introduced the National Mental Health Policy in 1998. From my side, I'm convinced that the development of this policy is compelling in overcoming the mental health issue in Malaysia. The reason I say that because the government fulfilled the third objective of this policy. This can be seen when the government took various initiatives to help people who have mental illness such as depression, anxiety disorder, and obsessive compulsive disorder. For example, the government provides counseling and psychotherapy sessions. These sessions were open to anyone who needs therapy or counseling service for free. We know that this treatment in Malaysia is quite expensive. So by introducing this program, the community can take a golden opportunity to get counseling service without they need to think where to find enough money to support the medical costs. In addition, the government also does not miss out in identifying the target group that need to focus on. According to the National Health and Morbidity Survey 2015, 39.2% of Malaysians between the age of 16 to 65 involved in mental illness. Meanwhile, children were recorded as 12.1%. So, based on the information, the people who have psychiatric disorder are those aged between 16 and above. Therefore, the government pays more attention to this target group in helping them fight with the illness successfully. Recently, the government introduced the Heal Line as an endeavor to help this group. The citizen can make call to the number 15555 to share all the problems that they are facing with the counselor, such as conflict at work, financial problem, relationship problem, and so on. Next, the counselor will find the best way to help that patient to get out of the dark place by giving advice and sharing useful tips to prevent themselves from continue think negatively. For me, this is one of the first steps in preventing this mental health issue from becoming more serious. Moving to the next point, the government's effort in collaborating with multi-sectors successfully in fulfill the fourth objective of this policy, which this can be proven through the government action in attracting the attention of the community to get involved in the mental health program that was implemented. For example, the Ministry of Health collaborates with TikTok in promoting mental well-being to the community. TikTok introduced hashtag Kita Jaga Kita to make it easier for the user to search for mental health issue. When they press the hashtag, they can access a lot of the latest information easily, such as current news, healthcare tips, interesting program, and so on. Then, the community also has the chances to share the experience that they have been through along the recovery process of mental illness to the public using these apps. For me, this is the best method to attract interest and give the community an opportunity to get involved in this program. I also believe that this way can give realization to the community that health is wealth. To sum up, I absolutely believe that this policy is effective in overcoming and controlling the mental health issue since it has made several objectives. This is because all the initiatives taken by government and non-government organizations are very helpful in helping the people who are struggling with their disease. Automatically, it can reduce the percentage of mental health problems in Malaysia. That's all from me. See you again.
the recommendations to achieve this objective is by ensuring in-depth training for all mental health providers. This is because mental illnesses are invisible, not to mention with the increasing number of mental health patients within children, this can lead to misdiagnosis. So therefore, when you have suitable, sufficient, enough information about mental health issues, this can reduce the chances of misdiagnosis from happening and also increase the effectiveness of this policy. Okay, so one way is by teaching and training PFA to the public. PFA is a humane response towards individuals that has gone through or is currently experiencing a rough patch in their life. So PFA can help with the rapid aid to the people, and this is one way on how the people can help and contribute to the effectiveness of this public policy as well. Thank you.
The next recommendation, to overcome the shortage of psychiatrists, the governments of Malaysia need to encourage more doctors, general practitioners and nurses to specialize in this psychiatry field. Malaysia must expand its pool of qualified mental health workers and professionals to meet the growing demand for psychiatric and mental health services in the country. The next recommendation, apart from placing a higher priority on consultation with adults, the government should also place a greater emphasis on early childhood mental health consultation. So, what is early childhood mental health consultation? It is a prevention-based strategy that connects a mental health consultant with adults who deal with young children. This consultation is very valuable for the kids to learn and grow, including childcare, preschool, home visiting, early intervention and their home. Lastly, we can say that mental health significantly impacts a person's life. The developments of the national mental health policy in Malaysia is seen to be very effective for the public. In addition, this policy needs to be continued and used by the people, but it has to be updated or improved so that it can keep up with the present situation that is occurring in the globe today. We reporting to you live, news to you.